This is one of the very important cardiac remedy. This is not digitalis, or this is not cactus, or this is not crataegus, or this is not calmia. This is specially indicated for valvular heart disease, maybe of mitral regurgitation or tricuspid regurgitation or mitral stenosis or aortic stenosis as a result of rheumatic fever. You can think of this remedy. This is not again calmia, this is not spigelia. This is indicated where the heart is in a state of failure, not completely failed, but heart is unable to compensate. As a result, there is full of edema, full of anasarca, maybe of ascites, or maybe of JVP is raised, where heart is in a state of failures. Where this drug can prevent cardiac failure by giving, it has got more of diuretic action. This is not again apocynon, or this is not apis. This is a excellent remedy for the people who have got chest pain, palpitation with marked venous engorgement. This is a drug belongs to the family Ranunculaceae. This drug is commonly called as a pheasant eye. Pheasant eye because this the flower resembles the eye of a bird called pheasant. This drug is called Adonis Vernalis. Adonis Vernalis. This is one of the commonly used cardiac remedy in our day-to-day practice. This remedy is specially indicated for valvular heart disease as a result of rheumatic fever. Adonis Vernalis is commonly called as pheasant's eye. Pheasant's eye it is called because the flower resembles the eye of a pheasant. Pheasant means a bird. We can see the images of the bird in the next slide. It's also called as spring pheasant's eye, yellow pheasant's eye. It's also called as false hellebore. Someone who identified this plant as helleborous plant of Hippocrates, but that is actually falsely named. Real helleborous is a different plant. So it has also been called as a false hellebore. These are the various common names of Adonis Vernalis. This drug belongs to the family Ranunculaceae. We have got many drugs from the family Ranunculaceae, most commonly drugs like pulsatilla, aconite, Actia spicata, Actia racemosa, Clematis erecta, Helleborus nigra, Hydrastis canadensis, Ranunculus bulbosa, Staphylos aureus, etc. The drug lists are many. To prepare the medicine, the whole fresh plant is being taken, especially during the flowering season, without the root. Adonis Vernalis is a native of northern Europe and southern Siberia. This drug, Adonis Vernalis, is been proved by Dr. Moore in the year 1888. This is the short introduction about Adonis Vernalis. You can see the image of Adonis Vernalis plant. A beautiful yellow colored flower. It is a perennial flowering plant in the buttercup family of Ranunculaceae. This herb can grow up to 10 to 30 centimeter in height. The strong rhizome produces fertile and sterile shoots. The erect stem has a sessile feathery leaves. You can see the leaves are totally different from the normal leaves. The leaves are like a feather, sessile leaves, and each leaves in a group ends with a flower with 10 to 20 elongated petals. To prepare the medicine, the whole fresh plant has been collected, especially during the time of flower, without root. Adonis Vernalis plant is cultivated as an ornamental plant for the beautiful yellow colored flower. In the wild, spring Adonis is found in rough, stony grasslands and scrubby pine woods, and also on dry hillside. This plant is found. In this slide, you can see Adonis Vernalis flowers in groups. These flowers are found over the woolly type of leaves or spongy type of leaves. This looks beautiful, but at the same time, this is highly poisonous plant. This plant contains cardiac stimulant compounds. The whole plant contains various cardiac glycosides. It contains adonidosine, adonitoxin, adonivernoside, which are toxic in large doses. As we said in the initial part of the video, the common name is pheasant eye. You can see a bird in the right side corner, that's a pheasant. Here you can see two types of flowers. One is yellow flower, one is a red colored flower. The yellow flower is called Adonis Vernalis. At the same time, you have got a red colored flower is called Adonis annua. A red colored flower almost resembles the eye of a pheasant. That is the reason why it got the common name pheasant's eye. Yellow colored flower has been called yellow pheasant's eye. The name pheasant's eye refers to the likeliness between the colors of its flowers to the red eye of a pheasant. That is the reason why the common name is pheasant's eye. There are many medicinal uses from this plant. Adonis vernalis is well known for being used as a cardiac tonic, having a tonic effect on the heart. The plant contains cardiac glycosides, as we said in the earlier, and this improves the heart's efficacy by increasing its output at the same time as slowing down its rate. Details of pathophysiological action of Adonis vernalis we'll see in the following slides. In this slide, you can see images of Adonis and Aphrodite, Ayre's wild boar, and a deathbed or death scene of Adonis. So there is a story behind why this plant is called as an Adonis vernalis. There is a love story between Aphrodite and Adonis. Aphrodite is an ancient Greek goddess. She is the goddess associated with love, beauty, pleasure, passion, and procreation. She was syncretized with Roman goddess Venus. Aphrodite, a Greek goddess, is desperately attracted to the young Adonis. But Adonis is more interested in the art of hunting. There is a desperate love story between Aphrodite and Adonis. The plant got its name from the Greek legend, the Greek god of land called Adonis, who was the lover of the goddess Aphrodite, was killed by jealous Ares, who had transformed himself into a wild boar. You can see the images of wild boar killing Adonis. But Greek goddess Aphrodite does not resign herself to the loss of her beloved and decided to metamorphose him into a beautiful flower growing from his blood and which still remain as a symbol of her frustrated love. As we all know, people say love means heart. There's one more story. Aphrodite's tears mixed with Adonis' blood, which touched the soil, the flower grew. So everywhere, whenever there is a disappointed, we can say love failure. Adonis, the story behind a love of Aphrodite and Adonis, when the love is failed, or love is failure or we can say cardiac failure, and this drug is indicated for heart failure. So that is the reason why this drug received the name Adonis. Again, Vernalis. Vernalis means a spring, as this flower blooms mostly in the spring season. So beautiful story, resembles the story of Greek goddess Aphrodite and Greek god of plant Adonis. Since the first compound is been isolated from Adonis plant in the early 19th century, there are more than 120 compounds have been isolated and identified till date. Adonis vernalis flowers mostly bloom in the month of March to May. The yellow colored flower which faces the sun, forming a yellow disc visible from very far. Adonis vernalis is an endangered species and protected by law. It can be found in Switzerland, France and Germany. The original area of distribution is in the steppe grass island of southern Russia or north of the Black Sea. Keynote indication of Adonis vernalis. The first and the most important keynote indication of Adonis is an excellent cardiac medicine. Specially indicated diseases of the heart after an rheumatism, after a rheumatic fever, or heart disease after an influenza, or a heart disease after a Bright's disease, where the muscles of the heart are in a stage of fatty degeneration, regulating the pulse and increasing the power of contraction of the heart with increased urinary secretions. So this is indicated where the heart has been damaged as a result of a rheumatic fever, or heart has been damaged as a result of influenza or a pneumonia or nephritis. As a result of rheumatic fever, there is a valvular insufficiency, maybe of mitral stenosis or aortic stenosis or mitral wall prolapse or aortic wall prolapse as a result of rheumatic fever. This drug will help to increase the contraction of the heart and it will help to increase the urinary output. That is the first indication of Adonis vernalis. The second indication of Adonis vernalis is indicated for cardiac dropsy. There are many drugs for the dropsies. We have Epis, we have Epocinum, we have Chelidonium with various reasons. But Adonis is mainly indicated for cardiac dropsy. It is not only for the cardiac dropsies, it is also indicated for hydrothorax, it is indicated for ascites, or it is also indicated in general anasarca. Everywhere pathologies as a result of diseases of the heart, maybe of mitral stenosis or aortic stenosis or regurgitations, or valvular, in general any valvular lesions with marked venous engorgement. There is a marked GVP is raised and full body has been bloated. There is full of edema. That is the indication of Adonis vernalis. We need to compare Crataegus also. We need to compare digitalis also. We need to compare Epocinum and we need to compare Epis. The third keynote indication of Adonis vernalis is compensatory hypertrophy of the heart in cardiac stenosis and mitral regurgitations, or mitral and aortic regurgitation, or any valvular heart diseases. As a result of chronic valvular heart diseases, the heart muscles are in a state of hypertrophy. That comes the indication of Adonis vernalis. Adonis vernalis is not only strengthens the myocardium, it increases the cardiac contractions and the arterial tension. But it has also a strong diuretic effect. It is sometimes astonishing how fast the effect of Adonis Vernalis. It has been said that Adonis Vernalis is more superior than digitalis in cardiac dropsies. But it is usually not very long lasting, and it may be necessary that we need to repeat this medicine very frequently for the better result. So you can think of this remedy where the cardiac muscles are hypertrophied as a result of valvular heart diseases. The fourth keynote indication, it is indicated for rheumatic endocarditis like our calmia, with all the common symptoms like precordial pain, palpitation and dyspnea. You need to compare calmia, you need to compare spigelia. Fifth keynote indication of Adonis Vernalis is regarding the headache, where the person feels very light, let's say aching type of pain across the frontal portion of the head, headache from occiput around the temples to the eyes. We have remedies, spigelia from left occiput to the eyes. We have remedy gelsemium, both the occiput to the eyes. We have sanguinaria from right occiput to the eye. So this drug you can think not as an important remedy for the headache, but along with the cardiac complaints, person is also having a headache where the head feels very light and aching type of pain along the frontal area, the pain from the occiput, temples to the eyes. You can think Adonis is also an important remedy. The sixth keynote indication of Adonis is regarding the urinary complaints. As we all know, that is an excellent diuretic with cardiac diseases, where the urine is oily pellicle on the urine. The urine looks like a oily. The urine is very scanty and albuminous. And albumin containing urine, in particularly very scanty urine secretion with a tendency for cardiac dropsy or anasarca and edemas, you can think as an Adonis Vernalis. You need to differentiate other drugs where there is a dropsy like epis, we need to differentiate epocinum, and also for the oily urine you need to differentiate terebinth. Terebinth is also an excellent remedy for the oily urine with anasarca or ascites. Another keynote indication of Adonis Vernalis, it is indicated for the people who are restless, people who are having horrible dreams. Apart from various cardiac indication, Adonis Vernalis also has got a kind of mild sedative effect. It not only calms down the nervous heart complaints with tachycardia, arrhythmias or extra systoles, but it also has got a effect on apprehension or anxiety or restlessness, which are very often associated with many of the cardiac patients who are suffering from heart diseases. This is also indicated for the people who is having toxic thyroid or thyrotoxic symptoms. You can think Adonis is also an important remedy other than iodine or natriumur or thyroidinum. Another indication of Adonis Vernalis is regarding the aching in the nape, or the spine is very stiff and there is a full of aching type of pain, which is again a common symptoms of many of the Ranunculaceae family. We have got the symptoms in Actia spicata, we have got the symptom in Actia racemosa. Along with the cardiac symptoms, along with the cardiac dropsy, where the person is having aching in the spine, or the spine is very stiff and a tight feeling, you can think as an Adonis Vernalis. Another keynote symptom of Adonis is regarding the pulse. The pulse is very rapid and it is very irregular and it is feeble pulse. The weakened heart try to increase the output of the blood, but because of the weakness of its contractive force, It can only raise the number of heartbeats, resulting in a rapid but very feeble pulse, and very often it is irregular. We know that irregular pulse, there are many remedies like digitalis. Digitalis has got every 5th, 7th and 3rd beat is missing. We need to differentiate Adonis from digitalis. We'll see what are the indication of Adonis Vernalis in respiratory complaints. Here the respiratory complaints as a result of chronic cardiac diseases. The patient may have a dry, tickling, cardiac cough, or patient may have cardiac asthma with feeling of some heavy weight is being kept over the chest, with frequent desire to take a deep breath. The dyspnea, which often occurs in connection with precordial pain and palpitation. This pain is worsened when someone touches in the back. This is in short about the respiratory complaints of Adonis Vernalis. This happens as a result of chronic cardiac diseases. You need to compare other respiratory remedies like arsenic alb. We need to differentiate ipecac. We need to differentiate spongia, which also has got some of the cardiac symptoms. Adonis Vernalis in renal complaints. As already mentioned above, the most important symptoms of the kidneys are scanty urine or sometimes albuminous urine with a tendency for edemas. Adonis is not a well-proved remedy. Most of the symptoms are as a result of clinical observation by the leading practitioners. Whenever the person who is suffering from cardiac diseases with a dropsy or anasarca, when you prescribe Adonis Vernalis, the first things to happen is the urine output will be increased. So that is a plus sign that this medicine is acted. This remedy has got a marked diuretic effect. It will increases the urinary output. As a result of increased urinary output, the cardiac strain is reduced. The person feel better. The breathlessness will be relieved. The chest heaviness is been relieved after passing urine. Apart from this, the urine has got an oily pellicle on the surface of the urine. That is an additional point to differentiate this remedy from epocinum, this remedy from epis, this remedy from terebinth. Adonis Vernalis in cardiac symptoms. As many of the symptoms we already discussed in the keynote indications, it is not so well proved remedy. We don't have many of the symptoms, but most of the symptoms are verified by many of the leading practitioners. As we all know, here the cardiac complaints occur as a result of rheumatic fever, as a result of influenza, or as a result of recurrent respiratory infection, as a result of pneumonia. Indicated clinically for rheumatic endocarditis, where the person will have severe common symptoms like the person will have precordial pain, person will have palpitation, person will have dyspnea. So as a result of recurrent infections leading to damage the cardiac walls, maybe of mitral stenosis or mitral regurgitation, or pulmonary stenosis or regurgitation, or tricuspid stenosis or regurgitation, or aortic stenosis or regurgitation, where the heart is in a state of hypertrophy, where the heart is in a state of fatty degeneration of the heart. A heart is unable to pump out as a result of full of venous engorgement. The JVP is raised. There is a full of hydrothorax. There is full of ascites. There is a full of anasarca. There is a full of edema. There comes the indication of Adonis. There is a marked venous engorgement. Clinically, you can think as in cardiac asthmas. You can think in many of the valvular heart diseases. You can think of in fatty heart. You can think of myocarditis. You can think of in rheumatic fever, or you can think of anywhere there is irregular cardiac action associated with vertigo, associated with a rapid and irregular pulse, where the person is very much restless, person is full of anxious. You can differentiate many drugs like Cretagus you can differentiate aconite, you can differentiate apocynem. You need to differentiate apocynem. I don't think apocynem is a remedy only for the renal complaint. Apocynem is also very important remedy for the valvular heart diseases, especially for the tricuspid valve diseases, where right side of the heart is affected. You can think of apocynem. Epis, in general, a dropsy as a result of renal pathology, where you can differentiate more of renal pathology. You can think of epis. More of cardiac pathology and going for the dropsies, you can think of Adonis and Crataegus and also digitalis. We will compare Adonis with Convallaria majalis. Convallaria majalis is another cardiac remedy. It is used for dilatation and hypertrophy of the heart or symptoms of the heart failure of the left ventricle. So here we have to differentiate. Adonis Vernalis common name is pheasant. Convallaria's common name is lily of the valley. Adonis belongs to the family Ranunculaceae and Convallaria belongs to the family Liliaceae. In Adonis we have got tiredness, weakness, apathy. Similar to Adonis we have got the symptoms in Convallaria majalis also. Convallaria also is a diuretic. In Adonis, the complaints are better by outdoors, whereas in Convallaria, the complaints are aggravation by slightest movement. In Adonis, complaints are aggravation by morning when they are waking up, but in Convallaria majalis, the complaints are aggravation by slightest movement. This is how you can differentiate Convallaria majalis with Adonis. Most of the symptoms are very similar. With slightest movement is aggravation you see in Convallaria. Here we can differentiate Adonis Vernalis with Crataegus. Crataegus is an excellent cardiac tonic. It belongs to the family Rosaceae, commonly known as hawthorn berries. Here in Crataegus, the pathology is different as compared to the Adonis Vernalis. In Crataegus, the most of the pathologies as a result of atherosclerotic changes in the blood vessels. As a result of atherosclerotic changes in the blood vessels, Crataegus has a property to reduce the blood cholesterol levels. Crataegus has no cumulative or toxic action as that of digitalis. Crataegus is being used for lower and higher blood pressures, where the heart is slowly progressing to a cardiac failure, where the person has a tendency for collapse or the person has a tendency for confusion. Here it is not related to the valvular heart disease. It is mainly because of atherosclerotic changes. As a result of atherosclerotic changes, the heart is as a result of cholesterol deposits and leading to heart failure. There is a tendency for collapse. That's how we can differentiate Adonis pathology and Crataegus pathology. And modalities, Adonis, as we know, better by outdoors, aggravation by waking up in the morning. Even in Crataegus, the person feels better by outdoors, better by quiet, better by sitting in the open air. And aggravation in Crataegus, aggravation by slightest exertion, aggravation by night, and aggravation also in a closed warm room. We will differentiate Adonis with Strophanthus. Strophanthus is a very important cardiac remedy. It is again a great diuretic like our Adonis. Strophanthus is specially indicated for the end stages of cardiac diseases, specially indicated for the old aged, and it is very safe to give as compared to digitalis and Crataegus. This drug belongs to the family Apocynaceae, so mainly useful for functional cardiac affections, especially of alcoholics or smokers or tea drinkers, where the person will have palpitation, full of dyspnea, where the extremities are very cold, with severe stitching and twitching type of pain at the apex of the heart. Associated with cardiac symptoms, person will have a kind of pressure in the stomach or kind of heaviness in the liver region with eructations and cough. The many complaints are aggravation by pressure, aggravation by eating, and better by lying on the back. Strophanthus is mainly indicated for end stages of the heart disease, and it is very safe to give, and it doesn't have Strophanthus doesn't make any irregular contraction of the heart, and it is a safe diuretic. We will differentiate Adonis with digitalis. Digitalis is again a drug belongs to the family Apocynaceae, commonly known as a foxglove. Digitalis is a valuable remedy mostly in the functional or organic heart diseases, indicated for coronary diseases, indicated for dilatation or hypertrophy of the heart, with high blood pressure, hypercholesteremia, or diabetes, with a sensation as if heart is stopped beating for a while. Heart is stopped beating if he moves. He must stay still or he must sit, then only heart will beat. The pulse is very slow, weak, and very irregular pulse. And digitalis is very famous for every third, fifth, or seventh beat is missing. An aggravation by slightest movement, aggravation by eating, and also aggravation by music, aggravation by lying on the left side. And you should be very careful when you prescribe digitalis because it can produce arrhythmias. If you are given without much indication, if you start simply giving based on the disease name, then there will be a complication. So that's how we can differentiate it. Adonis from digitalis. We differentiated Adonis from Strophanthus. We differentiated Adonis from crataegus. We differentiated Adonis from Convallaria majalis.